Doctors of Reddit, what's the best asking for a friend story you've heard? I have read that in some famines, that is possible. One of the baby's parents must have her ancestor of another race. I knew a family that had this happen. The great-great-grandma was dark-skinned, and they were very light-skinned. Caused confusion until a family member mentioned this. My father was born with extremely dark skin. Russian soldiers told my Oma that he couldn't have been her baby, that he had to have been a black child. Changed wording. My mother said she wondered if we would have the same skin tone he did as a baby. Not a doctor, but I saw this dude say to a doctor, "Can two white people have a black child?" Asking for a friend. The man's wife had an affair. Edit. The dude had the baby in the stroller, and when he was walking out he looked like he was going to yeet the child, and I was secretly dying inside. That's rough. He must have had so many emotions running through his head. I wonder if the guy ever suspected anything before his wife gave birth. One of my besties called me late at night after his day party. He said someone who was staying the night wanted to have sex with his GF. They were drunk and a little uncoordinated, and somehow the frenulum, the little string thingy at the tip of the penis, ripped, and it won't stop bleeding. I gave his friend some general advice on stopping the bleeding, and recommended a trip to the ER. The next day he asked me if I had any recommendations for urologists for his friend, because he needs minor surgery on his PP. I told him to cut the bullshit, and in response he sent me a pic of his injured penis. So, long story short, his one got a remodeling, and he is still with this vagina dentata sporting woman. I like that the friend was having sex with his girlfriend, and he was still supportive enough to ask advice for the friend. Studies have been done about the effects of THC on glaucoma. When I worked for a glaucoma specialist, we had a hippie type person come in with their family member for a new patient eval and ask the doctor to sign paperwork okaying a medical marijuana script for the patient's glaucoma. Problem was the patient was totally fine, didn't find any signs of the disease, and his eye pressure was within normal limits. And the doctor did not appreciate having someone try to trick him. To piggyback off of this, and because I'm tired of the questions, marijuana only lowers your eye pressures for maximum 4 hours. To have sustained effects you'd need to hit the blunt 6x a day and nearly 2200 times a year. Take the damn eye drops. Eye doctor here. Finally closed our offices to all but emergency care. Last year or so I had a staff member ask me for a friend if she got shot in the eye with cum and is now getting mild discharge. Is that okay? I looked at her eye and saw discharge. Went to the cabinet, gave a bottle of antibiotic to her for her friend, and then went back to my patients. 2 days later I look at her and say, "Your eye is looking much better today." She says thanks. The discharge stopped a half day after using the drops. Not a doctor, but I was an intern. I was in the OPD and this man from a different province came in and told me his friend has injected petroleum jelly in their member years ago and that now it's getting painful. Yeah, he came back the next day and showed his lumpy member. Edit. For clarification, this is done to increase girth of the penis. This is a common thing apparently. Saw a patient who did the same, had to have his penis reconstructed. He told everyone it was worth it. Not a doctor, but public health worker. Had an older man come into our clinic asking for a specific type of STD check. Guy's ex-wife was going around telling rumors that he was having sex with his goats, so was wanting to know if there was a way we could do a STD test that could prove if he had/hadn't had sex with any goats. Through this whole conversation, he just abruptly asks, "So if someone was having sex with a goat, what STDs could they get?" That dude is totally fucking his goats. Edit. Typo. Wow, good thing you don't live in Norway. Apparently they will revoke your driver's license the second they suspect you may have issues with drinking. Edit. I would just like to specify that I do not have personal experience with this and don't know for sure. I just recall seeing a post on our Norwegian subreddit about a guy who was depressed and suicidal, who had gotten drunk once several days before seeing his doctor about getting help, who then had his license revoked. There were also several people in the comments saying they'd had a similar experience. I asked my doctor about AA for a friend of mine. Really? Years later the doctor still asks me how I'm doing with my sobriety. I stopped trying to convince him I really was asking for a friend. So, how are you doing? Staying clean and all? Edit. Wow, my first silver and my most upvoted comment at the same time. Also, looking at the comment below I have both *USERNAME checks out and *RELEVANT username. Divorced women/cougars like to explain muscle strains as sex injuries to get a rise out of docs. Best way to deal is to stay monotone and not react. Patient describes proximal adductor muscle pain in hip flexion during recreational activity. Rated 7/10. Pain is now present during ambulation. If you don't react, they move along. Doesn't take long in the office to have seen and or heard everything. I'm not interested that you are recently divorced, started working out, and discovered Tinder. Good on you, but it takes more to get a rise out of me. One colleague in training had a professional cuddler with a similar injury. Doc was very conservative, possibly on the sheltered side, and in front of two of his superiors during the case, and she was not shy. I would add she was not visually what I assume most would hope for in a professional cuddler either. That one I enjoyed, on account of him, not her. I'm a veterinarian. When taking a dog temperature rectally, an owner going mummy doesn't like it either. I'm so glad my dog is the opposite. Took her in once because she was yelping and limping randomly, and I thought it was because she pulled a muscle, possibly related to a little arthritis she has in her knee. It was heart-wrenching to see her avoid greeting us because she was in pain. She's also a retired pharmaceutical research beagle, and as a veterinarian took her leg through the motions, trying to see if anything was causing her pain. She said I don't know if she would complain if any of this did hurt her. She's so well behaved on the table, she'd let us do anything to her. Yes, she absolutely would, except for nail trims. Blood draws, urinary draws, thermometers are all fine, but don't touch her paws. We had been using Valium for nail trims, but based on her history as a working dog who still responds to handling as a cue to stay perfectly still, we decided to start using a Thunder shirt. She seems to be doing just as well in a Thunder shirt as with Valium now. Not a doctor, but was mistaken for one by a drunk dude at a costume party once. Okay, twice. Sent him to sober up the first time, comes back 5 minutes later with no recollection of our first conversation, and asks me for painkillers, and at which dose they kill you. I gave him the number for the suicide prevention hotline on a napkin, and told him that they can help with the issue. He happily staggered away, and I haven't heard from him since. Either he got help, or he didn't, but either way, it was a weird experience. When I was in med school, one of my classmates, who was always a bit unfocused, asked a psychiatry professor during a lecture if there was any research about cannabis and other drugs going on at our university, in case that group needed another PhD student. This classmate didn't graduate, as far as I know. I met him a while ago, and he looked like a stereotypical hippie. Looked past me, not at me, and didn't recognize me, even though we were in the same case group a bunch of times. Seems like he found his own way of researching drugs. Well, one time had a guy say what happens when you stick a tapeworm up your penis, and then he immediately followed with I'm asking for a friend. My thing was he was squirming a lot, so I had already assumed he was lying, so I told him he should go to the hospital to get it checked out, but I don't know if he did. It was very strange. Not necessarily asking for a friend, but my mom worked for a doctor in my hometown. He was a foreigner. I needed to see him one day, and he begins telling me that not him, but his foreign French friends think Americans are stupid, lazy, fat, etc, etc. But he was saying it with a lot of oomph behind it, like he was disgusted. My cousin is always telling this story to my sister when she's drunk. The girl who came in asking if her friend washes his condoms after sex and reuses them, would they still be able to work? After a week, the same girl comes in to ask my cousin to tell her boyfriend that the kid was his. Apparently this friend she was asking about was her boyfriend's close friend who she cheated with, and he got her pregnant after using condoms more than a few times to save money. Won't be saving money for condoms anymore, that's for sure. I just can't imagine being that cheap. Even if you need a special brand, it would have been less expensive than a paternity test or a baby. I asked for a friend about hormone therapy. She had just come out to me as trans, and I wanted direct information in order to help her as best as I could. I did not expect my doctor to dig out my old blood work and tell me that my transition from female to male would be easier than most due to the already high amounts of testosterone in my body. She asks me every once in a while if I'm ready to start treatment. I don't know if it's a joke or if she legitimately thinks I'm trans, as I've explained why I've asked in depth multiple times. Not a doctor, but my dad asked this to my doctor, and it was embarrassing. My mom was in the middle of an anxiety attack, so she took one of my takers needed anxiety pills, and she got extremely nauseous. So my dad asked my doctor about, and he just gave the clearest "I'm going to answer that question, but pretend I didn't hear it" yeah I've ever heard. I ain't a doctor, and this has almost nothing to do with the story, but I remember I was once dared to ask a pharmacist if they have pills that will make your butt bigger. I was laughing a bit, and was very embarrassed after. Then my friend said I ruined it with laughing. So I'm gonna go into a pharmacy as a 12-year-old and ask for that kind of pills. I laughed on purpose, so the pharmacist can at least realize it's a dare. That's very true. Also a quick off-topic question. Is there any point in low gluten foods? Isn't any gluten at all harmful to someone with celiac or intolerance? Maybe for someone with a mild intolerance/sensitivity, but for actual celiac, usually even tiny amounts can make them sick. A good friend has celiac and I actually have a separate pan, knife, and cutting board that nothing with gluten ever touches, and scrub off a dedicated counter when I'm cooking for her. I'm one of the few people she actually trusts to cook for her because I take cross-contamination seriously. Thank you for watching. If you enjoyed the video, hit like. If you would like to see more, feel free to subscribe.